So now moving on to GU, let's talk about bladder cancer since you guys are having such a bladder moment since about a year and a half ago when you guys changed the landscape for first-line metastatic bladder cancer. What are you excited about to come out with ASCO this year?
So I feel like there's a lot of exciting data that's going to be discussed as far as new updates in bladder cancer. So one of the first ones is in non-muscle invasive bladder cancer, which is the CREST study, which is looking at sasanlimab. It's a subcutaneous PD-1 inhibitor with BCG in high-risk non-muscle invasive bladder cancer. This was presented at AUA not too long ago, and we heard that it met its event-free survival there, but we are going to hear more. And again, this is for BCG naive, high risk non muscle invasive bladder cancer. So be interested to hear more about that. One of the other exciting orals is on a drug, which I'm going to butcher the name, called padiloporphin, a vascular targeted photodynamic therapy. This is in low grade upper tract urothelial carcinoma. There is a study for neoadjuvant sacituzumab. Reminder for our fellows listening, this is a TROP2 antibody drug conjugate. It was previously approved in refractory metastatic urothelial carcinoma, but the approval was revoked based on the TROPiCS-04 data just at the end of last year, and they can definitely test you on that mechanism of action. So it's given in this trial called SURE-2 with pembrolizumab in muscle invasive bladder cancer. So again, that's neoadjuvant sacituzumab govitecan with pembrolizumab. And then we're also going to hear about CDK4/6 inhibitors, which we know about from breast cancer, now in preoperative cisplatin ineligible muscle invasive bladder cancer. So that's abemaciclib. And I'm really excited to hear about ctDNA in muscle invasive bladder cancer from the NIAGARA trial that was presented at ESMO just last year. So we're hearing a lot more about ctDNA in this space as a prognostic marker. A reminder that NIAGARA is GemCis with durvalumab in the perioperative setting. So you give GemCis durva for 4 cycles neoadjuvantly, and then you give durvalumab adjuvantly. And we're going to be hearing about the ctDNA response as far as these patients. And then it's also important to note that they allowed a creatinine clearance down to 40 for these patients. So this has been our new standard of care for cisplatin eligible patients with muscle invasive bladder cancer. So I'm looking forward to hearing more about ctDNA here. And then in the metastatic urothelial carcinoma setting, we will hear about a novel Nectin-4 antibody drug conjugate with toripalimab immunotherapy in frontline metastatic urothelial carcinoma. We'll also hear about an exploratory analysis of responders in EV302, which, as you mentioned, has been our landmark frontline study that has changed the landscape of bladder cancer in its entirety. And then finally, we will hear about avelumab with sacituzumab versus avelumab maintenance in the JAVELIN Bladder Medley trial.